You can watch the best parts of this series at MedCircle.com. Have you ever felt self-conscious or afraid of embarrassing yourself? These are common feelings, but imagine if these feelings became so persistent that they severely impeded every single social interaction. This pattern can be mended through the right education, which is what this series provides. Welcome to the MedCircle original series, Avoidant Personality Disorder, Finding Relief from Fear of Humiliation. Clinical psychologist, and tonight, Lady in Red, Dr. Ramani is back talking to us about avoidant personality disorder. We just finished filming our, man, it was a long series.
Yeah.
It was like 7 or 8 episodes or something like that. On avoidant personality disorder, you wanted to talk about this topic. You brought this to us, to MedCircle. Why?
I think it's something people, they don't even know what this is about. And it's this time where we're like, is he shy? Is he just socially awkward? It's one of those patterns where people don't even understand that when it gets to a certain level, there actually is not only help, probably a need to get that kind of professional intervention to alleviate that suffering.
So what is avoidant personality disorder?
It's a pervasive pattern where a person feels very inadequate and anxious in social settings. They feel socially inept, socially unskilled, and they're very inhibited in social situations. They're afraid of embarrassing themselves all the time across situations. It can be really paralyzing.
Yeah. You made it very clear to me when we talked about that this was way more than being self-conscious.
Absolutely.
That's not what this is.
No.
Yeah, this is somebody who's not excelling in their career because of this, possibly, who they're not having fulfilling relationships, maybe not even having relationships, because they cannot face being around people. They're so worried that they're going to embarrass themselves or somebody else. Yeah, a true disorder.
Yes.
Now, where does this fall in the clusters of personalities?
This falls into a cluster called C, which is characterized by more anxious and frankly avoidant patterns. People who are much more socially anxious, socially sensitive, who don't have an accurate appraisal of how they appear in social situations. And avoidant personality is sort of the most, to me, one of the more classical diagnoses. It's sort of sister diagnosis, if you will, one called dependent personality disorder, which I also hope we get to talk about on MedCircle, because there's a fair amount of overlap there.
Yeah, fantastic. We talked about the causes, always very interesting with mental health, because there's normally not a blood test you can just do. But you mentioned that in your experience, a lot of people who have APD, avoidant personality disorder, had a childhood that had maybe bullying or shaming. Can you talk a little bit about that?
Yeah, when we look at the origins of avoidant personality, it's a complex sort of soup of genetics, temperament, childhood environment, particularly childhood environments characterized by shaming by parents, shaming by a family system, bullying by peers or by siblings, as well as things like attachment style. And all of that comes together to really heighten the risk of developing an avoidant personality style into adulthood.
Yeah, one of the first takeaways I got from the series is when you talked about what healthy attachment looked like between a mother and a child.
Or a primary caregiver.
Or a primary caregiver, yes, thank you. And it was just a really clear example, and I want to share that with our viewers right now, so here's an inside look. Go back to the attachment styles you were mentioning. What do those look like?
So the critical research on attachment was originally done by Mary Ainsworth and John Bowlby, who sort of set the tone for this developmental research years ago. And what they did was they found that there were sort of 3 standard attachment styles. The attachment style we like to see is the secure attachment. In a securely attached child, they get a little upset when their primary caregiver drops them off somewhere, leaves them with a stranger. There's a little bit of distress. After the caregiver leaves, they're able to be soothed pretty quickly by the new caregiver, like a daycare provider or something. And when that primary caregiver comes back to pick them up, the child happily reunites with that person, okay? So it's a sense that, I don't like that you're going, but you've gone, and I'm gonna be okay because you're inside of me. And then when you come back, I'm happy to see you. That's what we're going for. That's secure.
Hear that, parents? That's the goal.
That's the goal.
Right.
That's the goal. The Anxious attachment style is characterized by the child who, when dropped off from the parent, becomes very disorganized, very chaotic, cannot be soothed by the person that they're dropped off to. Then when the caregiver returns, the caregiver can't soothe the child either. So they just can't calm down. They can't calm down, that there's this fear. And when we sometimes, for example, in children, there's even a pattern we call separation anxiety disorder. These are kids that do not soothe well when they're separated from their caregiver. One might say, well, what's the big deal? They really love their mom. Because pretty early on, we need a self-soothing mechanism. That mechanism is that we're like, she's going to be back. She's always been back. So
when should we have that?
That should pretty much have clicked into place solidly by 2 to 3 years of age.
Oh.
Young.
That is young.
Yeah. And I have to tell you, as a mom, I remember this very, very well. And I had the blessing of my daughter, both my daughters were in an amazing childcare facility where there was one-way mirrors. I was a hot mess when I had to drop her off. So I would stand and watch at the glass, and I had a little timer. You know, both my girls, they actually soothed pretty quickly. I'd say within 3 to 5 minutes. And then when I walked in, they're babies. So they'd either crawl, and then, there was just sunshine. And I'm like, secure attachment here, you know. So
and you were the only mother who knew what was going on.
Well, it was a bunch of psychologist kids, so I think everybody knew what was going on. But the fact was, it was that sense of, as a mom, you feel that too, right? Your baby's crying. So I had this blessing that I could look in, and then I would only leave after I saw that they had stopped crying.
And you said that this type of healthy attachment they should see in a child even as early as 2 years old, correct? 2 or 3 years
old, yeah.
Yeah. And what does that signify when they have that healthy attachment?
That secure attachment reflects a consistent caregiver, a caregiver who has soothed the child, a routine in that child's life, a sense of safety, of relative predictability. And while we often put that onus on the relationship between the caregiver and child, there are also factors of temperament in the child that can make that more successful. A smiley baby is easier for a parent to connect to as well. But that secure, safe attachment style, that's a style that's like money in the bank going into adulthood, because that creates security in many, many relationships throughout a person's life.
If that was one of 3 attachment styles that Dr. Ramani mentioned, if you would like to learn about the other 2, feel free to go to MedCircle.com, become a member. You can access that entire series where she, of course, talks about those attachment styles. Now, we also went into detail about the diagnostic process, finding the right provider, and what treatment looked like. Now, with avoidant personality disorder, medications aren't always used unless they're treating a comorbid or co-occurring disorder. What are some of those co-occurring disorders that are common with APD?
Co-occurring disorders or co-occurring symptoms, things like anxiety that's really overwhelming, depressive symptoms. In addition, keep being mindful of the fact that the person may have also a comorbid substance use disorder, like alcohol use disorder or other substance use disorder, that would need to be a central core and focus of treatment early on to ensure we can get that client sort of detox, clean, and sober, so they can also focus on the work of therapy.
And speaking of therapy, you brought up group therapy, which we don't hear a lot about on MedCircle, but especially when it comes to avoidant personality disorder, here's what you say, here's the role you say group therapy could play.
One kind of treatment we haven't talked about, Kyle, with avoidant personality disorder that also really bears further consideration is group therapy. The beauty of group therapy, which ideally is run by 2 group leaders so that the people in the group can also see what healthy interaction looks like, is the chance to practice and model those social skills and dealing with that social anxiety in real time with a therapist there. It wouldn't be an easy group because everyone would actually be really holding back. But I think group therapy is often one of those wonderful therapy models we don't give enough attention to. It's often very cost effective.
Yeah.
It can be a lot more affordable, but it gives you real time opportunities to practice those social skills, which can be very important in something like avoidant personality disorder, where a person says, oh my gosh, I feel like I'm being criticized. And you can actually ask that other person, are you judging them harshly? And I'll say, actually, no, I'm in awe of the smart thing that they just said. And it doesn't feel fake. It's a real person to a real person.
What I love is that there is so much hope for somebody with avoidant personality disorder. they can go from here to here. They can improve their lives. There's a lot of options for them. And in your experience, do you find that your patients improve?
They do improve. Again, like I've always said, you're not going from here to life of the party. You're going here to being able to take a few more social risks, to maybe talking to a few more strangers, to being able to talk about your vulnerabilities in close relationships. I think it's important to have realistic expectations. So definitely we can see progress, but there's work involved in that. It can feel like an uphill climb, but it's definitely not impossible.
What will viewers get after watching this series?
I think that this series is an introduction to a pattern, avoidant personality disorder, while not common, also has lots of subparts to it that they know people experiencing that are causing some distress in their lives. And so I think understanding this pattern, understanding ways to manage this pattern, how to talk to loved ones about it, or even for themselves, to understand that this could be a worthy reason to start therapy, and that their fear of being embarrassed or look bad socially could inhibit them from even going into therapy. My hope is that we open that door for these folks to say, maybe there is something I can turn this around. Maybe I don't need to feel the sense of loneliness and isolation anymore. So I do hope it gives people who are experiencing this, or people close to people who are experiencing this, some sense of hope and some strategies.
It will. And it gives them hope, but it gives them actionable steps that they can do. Within this series, we first define the disorder and help you recognize the signs. Then Dr. Ramani goes in depth to talk about the causes of avoidant personality disorder. She then discusses the diagnostic process, what that looks like, what questions your therapist or provider could ask you. Number 4, how to find the right provider. It is difficult, but she gives you some tried and true advice on finding someone who is the right fit for you. Then she goes over your treatment options, not just if it's medication or therapy, but what kind of therapy and how to track that progress throughout your recovery. Long-term management strategies, she gives some great ones there, and of course helps the supporters and arms them with the tools that they need to be the best supporter, not an enabler. There's a difference, being a supporter of somebody that they know with APD. Any final words on this series and what you want viewers to know before they watch?
I think that when we see certain personality styles that are associated with patterns we may not value as a society, like being shy or maybe even somewhat introverted, that those patterns, there's nothing unhealthy about those. That I think some people may see this and say, well, I'm shy, does that mean I have a disorder? No.
Right, you're just shy.
You're just shy, and that's okay. That's just, it's anything. It's like being stubborn or friendly, or, you know, it's just a pattern, it's who you are. I think that avoidant personality is really where the person really berates themselves. It's a sense of absolute social embarrassment and inhibition, never even taking a social chance. That really holds people back. And I want people to understand some of those differences and understand these patterns, because we do tend to over-pathologize people, again, who aren't overly extroverted, and understand that it's not a disorder to be introverted, but that when you feel socially so embarrassed, that's when it's an issue.
Well said, Dr. Ramani. I'm Kyle Kittleson, and remember, whatever you're going through, you got this. Thanks for watching. Your next step is to go to MedCircle.com and finish watching this series. There you can also access other series and get actionable advice and simple explanations. Continue your mental health journey at MedCircle.com, and I'll see you there.